Recently, I've been asked by some of my patients what vitamins and supplements they should be taking right now. Frankly, to my knowledge, there's no high-quality studies which indicate that vitamins or supplements have any real-world effect on viral diseases, especially ones like coronavirus. There, however, is a physiological basis that could support the use of some supplements. That is to say that there's no real evidence that they work. But at the same time, there may be a slight basis there. So I just tell people the supplements that I take, really. So I currently take zinc, quercetin, and vitamin D3. There's limited evidence for all of these. First of all, we start with zinc. In test tubes, we've seen that zinc can actually stop the replication of viruses. And for the most part, replication of viruses, especially ones like the coronavirus, seem to take place inside our human cells, not outside the cells. So getting zinc inside the body isn't that big. Getting it in the cells is the big deal. So quercetin has been shown, again, in test tubes to actually increase the amount of zinc from the outside of the cell into the inside of the cell. It increases the amount that the cell absorbs. So that's why I take those. I also take vitamin D, as vitamin D deficiency has been linked with increased risks associated with respiratory tract infections and just increased risk of getting an infection. Again, that's deficiency, not necessarily supplementation. So I'm probably not deficient in vitamin D. Most people aren't. It is, however, a possibility, so that's why I take vitamin D. So that's why I take those. In my case, there's little to no risk with taking these supplements. And while there may be no potential reward, I'm fine with that since the risk is so low, essentially nothing. So this is likely true for most people, but some individuals, this isn't true. So regardless of who you are, you really need to consult with a doctor before just randomly taking supplements, especially like these ones, because there can be adverse reactions, especially if people with certain diseases or on medications. So to sum it up, supplements probably don't help, or at least there's no evidence to really say that they do, but they might, so why not take them if it's safe to do so?